for a number of years, really. It started in the pharmaceutical industry, and I worked from clinical research into medical affairs, and as well as a little bit of marketing. Then I moved to France, and I continued along with those sorts of activities. And I've sort of become specialised in working with non-native speakers of English, particularly French writers, and working with them to help to really improve the way they present and write in English. Having said that, I'll try and speak slowly because I'm aware that many of you are non-native speakers. Please send me an email or a chat if I start going too fast. Okay, I wanted to start with a little bit of a thought. And I know what it's like, we're all busy. We hear things, we forget them. We see them, we might remember them. But usually when we do things, we understand. And that's what I'd really like to make today about, is to talk to you about some techniques. And at the end of this webinar, I'd like to give you the opportunity to practice them. And then obviously when you leave the webinar, try to find a moment that you can practice them in the next time you have to write something in English, to try to remember help you to remember some of these rules. So when we start writing, obviously some of this will be relatively obvious to some of you and maybe less obvious to others. Think why you're doing this, other than the fact that it's been asked of you, who you're writing to, and really what has to be said. Sometimes there are certain guidelines that help us to organize those sorts of thoughts. Sometimes there's key data that says how those messages are going to be created. But whichever way, it's important to find supporting messages that support all of those arguments that really need to be said, the what that has to be said. And the way that is done starts with words. And then it moves to sentences, paragraphs, and sections. And I stress this a little bit because when writing in English, when it's not a native language, sometimes it's good to come back to the essence of the word and the best word for what it is that you're trying to say. And this kind of helps some messages get from getting lost in translation. And it's also particularly useful when you're editing papers from non-native speakers of English, because sometimes they don't have the vocabulary, and the word might not actually, the word they've used might not actually really be the right word or the most appropriate word. So it's useful for you to sometimes use these techniques to go back to your clients and say, well, is that what you really meant to say? The other thing that I think is really important, and many of you will probably, hopefully agree, is that it's important to tell a story. And I really think science is full of wonderful stories, and every presentation or every brochure or every article really should tell its own small story. And like every story, it has to be directed to the person who you're talking to. So it might be the scientific community, it could be clinicians, and it's more often the general public. Even if the article is aimed at the scientific community, the general public is still reading it. So kind of we need to keep that little person sitting on our shoulder and be a bit sensitive to the way we write in case they find the stuff that we're producing. So what are we talking about? Well, it might be scientific findings, it could be clinical experience, it could be new medical techniques. There's all sorts of things that we're faced with writing today as medical writers. I would imagine most of you would know some of the guidelines that are available, and I will show some of the key ones in case you don't in a minute. But they're really there to help readers find the information quickly, and they're to help publishers to make sure that they include all the appropriate information to a publication. They're also very useful guidelines for those speakers of non-native speakers of English when they're starting to write articles, because it's a checklist. And I find it quite useful to just think, okay, what's got to go in? Have I included the randomization procedure? Have I included the ethics, blah, 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 etc.? Have I got my primary objective? Are there any secondary objectives? It's really just a simple checklist to go through and write a word, a key word, or a key phrase for each of those things. And to give you a little bit of an idea of why it's easy to read things that we expect, I'll show you a slide, and I'd like you to take a minute to try and read it, or 30 seconds to try and read it. Okay, so if you've managed to read it, some of you might have found it easier than others, but in fact, it's not that hard to read because the first letter and the last letter are correct, and the letters in the middle of the sentences and the middle of the words are mixed up. And so it just goes to show that the brain is very used to finding information and recognizing words no matter what order the letters are. And so it's important to keep a certain structure. The brain finds a certain structure, and scientists who are used to reading articles search for a certain structure and will search automatically for information in the article. And I will go on to explain to you a little bit exactly what information we expect to find where, and what helps us to read or speed read, what helps researchers speed read articles. So I would imagine most of you have probably seen this before. Certainly the layout of a publication I would imagine you would be familiar with. Some of you may not know some of the other guidelines like ICMG, CONSORT, Quorum, STROBE. These sorts of guidelines are set out to help writers decide really which information should be involved in a randomized controlled study, CONSORT for example. Quorum is a set of guidelines for systematic reviews and other sorts of reviews. And STROBE is a set of guidelines for observational studies. There are other guidelines which can be obtained either through the CONSORT site or, for memory, it's not EASE, it's the Equator network. They also have copies of all of the guidelines. And so because articles are written like this, we expect to find information according to these guidelines because more and more people are writing like this. Here are some of the websites where you can find some of those guidelines. Okay, and to give you an idea of what they look like, and when I said it was a checklist, it really is a checklist. So this is an example of the checklist for an abstract, for example. And it shows you exactly what needs to be included. And I would encourage you, when you're starting to write an article, to write a word for each checkbox. So trial design, parallel, cluster, it could be double blind, randomized, whatever the design elements are. If you have a nicely formulated sentence that you can take from the clinical study document, then you can copy and paste that already in there. But start to build your article from this checklist, and that will give you your outline. To give you an idea a little bit, if you have to go into an abstract of how much space, people often ask how much information should be involved in an abstract. And the results and the methods are probably the most important parts of an abstract. For the simple reason is that somebody somewhere needs to make a decision as to whether this study is worth reading or not. So that comes from the design and the methods, and then whether they found anything or not. It's also important to think about the title. The title, apart from being interesting, it is the first thing that people search. It's the first thing that readers will read and see. It has to give some defined information, so it might have to give information about the study design, the comparators, and other certain things that you may not be able to control. It is also the last thing that you're likely to write. Once you've written your paper and you really understand what the story is, then this title should pull together those key words that you have to put in and introduce the story. Okay, there are some things that we suggest not to put in a title. Afterwards, it's a question of style. These are not really guidelines, but avoid rhetorical questions, avoid long wordy titles, keep them short and sweet, and put in sort of key words that are really important. Anything that you can make it sound really interesting. If you've got good data, then put it forward, show that you've proven something or you've shown something. Think of the power of every word. Who is actually reading this? Is it for clinicians or is it for researchers? What is more important to them? The fact that it's a daily dose, or the fact that it's a oral dose, or the fact that it improves 12 months survival? It will be really important as to which words you actually put into the title. I like to use the key message of my article as the title. It helps me as I'm going through writing to really make sure that I stay on track, and that you can evaluate towards the end whether you really need to keep that or not. And the study design is another question. Some journals actually really insist or suggest that you do add the study design. Perhaps in some stages it's not appropriate to do so. Just ask yourself the question. Okay, so the introduction. So for young writers who are probably less experienced and wondering what on earth they should put in their introduction, I'd like to explain this a little bit like a funnel that is larger at the top and smaller at the bottom, and a story. So you start with who you're going to talk to, and then you think about what does this person really know, and what do I really absolutely need to tell them? Do I start from prevalence data, or do I start from the fact that, well, nobody really knows how to treat this disease? And that's how you build your funnel. And then you might look at, well, what's happening in research now? Okay, well, there's not a lot happening, or there's lots happening, or there's lots of little things happening, or there's not many things. Is there anything that's missing? So you can say, well, we've researched a certain area, but we don't know about side effects. We know about efficacy, but we don't know about side effects, for example. Perhaps there's a specific problem that needs solving. These are all questions that you can ask yourself to build your introduction. And your introduction really should not be any more than 5 paragraphs. So 5 main ideas, which means you can start with 5 words, which you can build into 5 sentences, and then create 5 small paragraphs to build it up. Your last paragraph, so the 4th or 5th paragraph, should be your objective and hypothesis. So your funnel finally leads down to really why the study was performed. Stick to your study objectives. So when you're talking about the reason why it's done, make sure it leads to the objectives. Stick to the facts. There's plenty of other interesting things to tell about a study, but eliminate anything that is not directly related to the study objective. And don't forget to provide a reference for each statement, except for everything that's sort of established science. Just move that. Sorry, I've just decided to move that, and I don't know why my presentation's gone on pause. There we go. Okay, so when you get to the methods section, most of this should come from your clinical study report. Some of you might not have the luxury of having a prepared clinical study report. My first advice would be to go to the journal in which you prepare, your author would like to publish, and have a look about how they set it out. They usually follow the same pattern each time. It kind of forms a usual pattern. They tend to put study design first, recruitment selection, inclusion exclusion criteria first, because that's what makes the study, what we're going to critically analyse the study on, its quality. And then sort of things like ethical statements, sources of equipment, statistical analysis tend to come at the end. Having said that, it is a generalization and each journal has their own specific style. But basically that's how it should be laid out. So the same thing as I said before, for perhaps less experienced writers, start with a word for study design, start with a word for patient recruitment selection. Try to draw yourself a picture of what was the population. Were they young? Were they old? Were they very sick? Were they sort of moderately sick? The sort of picture that a clinician might want to have when he's reading the article, and he can say, okay, yes, that's Mrs. So-and-so that I usually see, or Mr. So-and-so. Try and paint that picture for him with words from the data that you have. When you get to the results, I like to think about the results as a box of chocolates. It's like being in a French chocolate shop where you have 20 or 30 varieties of handmade chocolates, and it costs about 30 euros to buy a box of 6. And so you have to be very careful about the ones that you choose. And so I would look at all the data that you have in front of you and say, okay, which are the pieces of data that only go to support the primary objectives, the key secondary objectives. And often if you follow the CONSORT guidelines, you have to have some demographic data and the flow chart as to what happened to the patients, who were included, who were excluded, and for why. So that takes one chocolate, so that only leaves you with 5 chocolates to choose from. The discussion can be in any sort of order. Again, it's perhaps less rigorous than other sections of the paper, but most journals tend to follow the same sort of pattern. What are the key findings? So there's no new data. How does that relate to what's happening in the world? So what is your data compared to the others? Any of the strengths and weaknesses of the paper, any differences with other publications or their strengths and weaknesses. And then I really feel it's important to turn around and say, well, what does this mean? Is this paper for clinicians? So what does it mean for them? Does that mean that they can now go ahead and perhaps think about treating Mr. So-and-so or Mrs. So-and-so? Or perhaps this is just another step in the research and further research needs to be done? Etc. So, and that leads on to whether there should be future research, whether this opens new questions. So you can use this as a bit of a checklist, like for the earlier sections. And again, start off with a word, a key word, and then build it up into a phrase. Some people suggest to include references from opinion leaders or those people. That's a question of style. Obviously, you would reference the people who are mostly researching in this area. Some people also suggest to reference reviewers. That's again up to personal choice and with you and your client how you wish to manage that. But it's there as a kind of reminder. So that's how to build basically a publication. If we then get down to the nitty-gritty and we turn around and say, okay, all right, now I want to know how to do that really in English. And as I said to you earlier, communication starts with words. Then we build it up into sentences and phrases and sections. And the reason I go back to this, even if it might sound kind of obvious, if we start with words and we follow a certain structure, then we're only writing in English. We're not translating from another language. And so what I'd like to do is to show you a little bit about how we build sentences, how we build paragraphs, and what that kind of pattern is that that is kind of expected in scientific writing today. And I emphasize that scientific writing is not Shakespeare, and even for native speakers like myself, we need to be regularly reminded that we are no longer writing for ourselves. We are writing for an international audience. So it's important that scientific language becomes an international lingua franca that everybody can understand. So that's an advantage for non-native speakers, because it's easier for non-native speakers to write simply than it is for native speakers. I think an American guy wrote that clutter is the disease of American writing, and we are a society that is strangling in an unnecessarily world of circular constructions and pompous frills, etc., etc., etc. I would have to say that medical writing has been a victim of this too. I'm happy to say that it's changing, and I think it's up to us as a community to keep making it changing, making it international, making it simple, making sure that the message gets across. And to do that, I go back to what I've been saying since the beginning, is that we need to write starting with words, which is the opposite to what we do when we read. When we read, speed reading, we tend to look at big sections, titles, then we look for subsections, then we're looking at paragraphs that interest us, and then we'll eventually get down to individual words. But when we write, we need to start with keywords and the most important appropriate word for what we're trying to say. And for young writers or inexperienced writers, it's sometimes worth going through the phase of mind mapping or brainstorming, throwing words down on a page until you find quite the right synonym for what you're trying to say. I don't know whether you guys have seen this before or not. It comes a little bit, it's often used in marketing, etc. And it basically means keep it short and simple. Marketing people like to say keep it short and stupid, but it's a way of saying, making sure that you go to the essential of what needs to be said. So how do we do this in English? So for those of you who've studied English at school, you'll remember that an English sentence is built basically around the verb. So the verb is the most important word of the sentence. Then it has a subject, so who does what, and an object is the what. So what is the person doing? So if I give you an example here, we have patients discontinue treatment or their treatment. Okay, we have another idea, is the number is increasing. So if you wanted to join that together, you could make a sentence that looks a little bit like this. The number of patients who discontinue their treatment is increasing. The verb that's the most important for the meaning in English tends to go at the beginning of the sentence. The most important idea comes first. That's in terms of order, so if it's the oldest or the newest, whatever the stress is that you want to give, it goes towards the beginning of the sentence. Then it can be made a little bit more interesting by adding adjectives or adverbs. In this case, I've given an adjective, so an adjective describes the noun. In this case, so we're talking about the noun hospital, and we talk about an adjective, better. So there is, which is our verb, better, and then our subject, better what? Hospital management, and then we can continue and add other information if it's appropriate for breast cancer treatment nowadays. Then, once you have those simple sentences created, Then you can go ahead and I'm going to try and get rid of this again without making too much of a mess. And I've just made a mess. Okay, so then those can be joined together by link words. I've given you a list of 6 groups of link words that are used most often in medical English and scientific English. Basically, we're comparing, contrasting. We've got chronological order, we've got causes and effects, we've got lists of things, and we've often got examples. You may have your own favourite word that you like to use, but it's important, like it is in France with champagne, to not have too much too often, to use each word sparingly. And some words are really good as others. So a small word like to is just as good as furthermore or moreover, which we often see in France. So take the time to note some of these keywords down and change them as you're writing. So showing you then how we can put that all together. Going back to our original example where we had patients who discontinue breast cancer treatment. That's our first idea. And our second idea is that there is better hospital management for breast cancer. Okay, so this is a contrast. So I chose despite, okay, because I wanted to put a kind of a negative connotation to the second part of the clause. So I said an increasing number of patients discontinue their breast cancer treatment despite better hospital management. Okay, afterwards it's a question of style, but just to show you how you can link 2 simple sentences together, starting from words and then building up to sentences. So then I would suggest that you vary the way you write sentences, and some people ask, how can I make my writing look more interesting? Well, you can say the same thing, and I've chosen 4 particular examples. It's probably not all the possible examples that exist in the world, but I've chosen 4 ways that you can say the same thing differently. So if we're talking about time, you can say firstly, something happened, and now. Or you can put the emphasis on the efficacy, and you can say the new generation product is better than the old ones. The third example is comparing. So you say, okay, well, survival is better to compared to the first. Or if it's really interesting or important, then you can add a small introductory word like remarkably, interestingly, etc. These new products improve survival. So again, when you start from your words and you build it to a sentence, think about go back to your key message and think about what it is that you're talking about. Are you talking about the old way things were done and now you have a new solution? Or are you saying that, okay, well, things have been done like this for a certain while, but now we have a solution that is better in survival or less side effects or whatever it might be. So these are some ways you can change the way the emphasis is in a sentence. Showing you a little bit about structure and how a paragraph is structured in English. And if you remember in the beginning of the presentation, I said that Anglo-Saxon readers look for information in certain areas. And in fact, I would argue to say that international readers would start to do this because they're used to reading articles and they're used to finding information in this particular spot. So if you write out of that pattern, then they get lost. So each paragraph must contain one idea. The first idea introduces your point. Okay, the prevalence of stroke is increasing in patients aged over 80, whatever. Then you'll add a more restrictive sentence. So there is not enough first aid to patients who suddenly have a stroke. And then you might want to give an example. So for example, I don't know, 50% or 90% of patients who have a stroke when the emergency services arrive within 5 minutes have certain side effects. And then you go on and you say, okay, well, we have a certain solution for this. You might have a third point where you say, okay, there's certain research that shows that this has been useful, and then you finish with your hypothesis. This is an example of the sort of funnel picture that I was talking about earlier on in the presentation. So to give you an idea of what that could look like, I've taken an example from prostate cancer. So this is not a full introduction. This is just an outline for an introduction to give you an idea. So you talk about prevalence, and then you sort of restrict it by saying over the last 20 years prevalence is increasing or incidence is increasing. And then, for example, in 2012 there were 417,000 new cases in Europe. Okay, however, clinicians have got a lot of things to treat this condition. These treatments range from hormone therapy to surgical or radiotherapy or chemotherapy. However, one particular type, which is called androgen deprivation therapy, is used in a third of patients. A new generation of this type of treatment has been proven to extend survival. And here you can go on and talk about the mode of action, you can add extra data, you can talk about the studies that show this. And then you can say, but however, this review or this study was designed to overview the current standard of care or to test a new product, etc. When writing, having pulled all of that together, go back and check that the word that you've used is really as specific as you possibly can. And this is better to do at an outline stage than within your whole article, because it's easier to see. And once you have it in your outline, then you won't lose the sense in your full article. So you might talk about quality, for example, but what do you mean by quality? Is it cheaper? Does it meet the guidelines? Is it more effective? So try to avoid using words like quality and try to think about what sort of quality am I talking about? The patient reacted well. Well, that depends on what standard they were beforehand. So try to be more specific about the patient improved by such and such or whatever it might be. Treated by itself doesn't work unless you actually say what they were treated with. Other common mistakes are things like the patient's blood pressure was low. Well, that's all right, but if the patient always had low blood pressure, but that's not a problem. So low compared to what? So lower, lowest. I wanted to make a little note as well before I go on about capital letters and a bit about style, because I understand this varies from language to language. In English, a proper noun has a capital. You don't need to put a capital on every word in a title. The first letter of the title has a capital, but afterwards, unless it's a particular proper noun, it doesn't need a capital. However, the European Society of Cardiology, because each word is a noun in itself, would take a capital. The name of a bacteria or a genus or a species would take a capital in front, and the rest would be in small letters. And when it's shortened or abbreviated, it takes a capital for the first, for the family, and then a small letter for the species. Chemicals, I put this in. I'm not sure whether it's the same or different from languages, so I just put it in just in case. But they carry capitals for the first letter and small letters for the second letter. The first word in a sentence always carries a capital, so the cat and the hat sat on the mat. However, if the first sentence happens to be a chemical compound that starts with a number, then the number obviously stays as it is, and the first letter of the word becomes a capital. So I hope this might answer some of the questions about capitalizations. The other question about capitalizations comes in about how to use degrees. I've given a few examples here. A lot are readily available on the internet, so if you ever have a doubt, just double check on the internet. But there's a few kind of rules of thumb. Doctor is used for a doctor of medicine or a doctor of philosophy. But this would be used if you're writing an email, for example, Dr. So-and-so, dear doctor, and in which case the first letter is capital. The Americans use MD as their degree. So in that case it would be Joe Bloggs, MD. However, in the Commonwealth, having said the Commonwealth, I'm not 100% sure about Canada, so I'm going to kind of limit that to Australia, New Zealand, England, perhaps South Africa, where they would use MBBS, which means Bachelor of Medicine, Bachelor of Surgery, and in which case you would put Dr. Joe Bloggs and then MBBS, and sometimes they have a Master of Science as well, so you put their degree after their name. PhD is the traditional Doctor of Philosophy, although anybody seems to be able to obtain a PhD these days. And in which case you would say Dr. So-and-so, and then you would put PhD after his name, so we know he's a Doctor of Philosophy and not a Doctor of Medicine. And the other one that we often come up with was a Bachelor of Science. I like to spell it with the full stop in between, the B.SC. But I've noticed that it's quite often used BSc all joined together, so both are acceptable. And these goes for other things like BA, Bachelor of Arts, but that doesn't really concern us so much. I often get questions about word order, and I wanted to give you some examples of different types of word order and how you can make it right. And I realise my animation has, oh yes, it has come up. So if you look at both these examples, take a moment to think about which one you think might actually sound right. Okay, so to find out, the one that's going to be better is the one where the subject is as close as possible to the verb, which happens to be the first one. In this example, take a moment to read both versions and decide which one you think might sound right. In this case, anything that modifies the sense of the sentence should stay close together. So because asthma sufferers are prone to pollen allergy, we put those two together. And another problem that we have is when things are translated from another language or come in written by a non-native speaker and they need re-editing, sometimes it's a mix of both languages and grammar and vocabulary, etc., and it sometimes sounds very long. It also happens a lot with native speakers because they feel they have to write in sort of a more intelligent way. So we get sentences a little bit like this. And this is a real example actually, and it was 29 words long, and the author actually asked me to reduce the number of words because they had a problem with their abstract. To give you an example of how you could make that shorter, I came up with this particular one. So instead of 29 words, I got down to 13. So to show you a little bit about how I got there, I had to look at all of the words that have prepositions. Okay, prepositions are to, for, it, etc., that don't really add any meaning. I also had to get rid of any of the to be verbs that make it passive, and nominalizations, which is kind of a fancy word for a noun, which should be a verb. And then I had to look at it and get rid of any long introductory wind-up phrases. And I should probably add a fifth point here, because having done all that, often we need to really look at vocabulary and try and decide whether it's appropriate or not. Sometimes the word looks like old-fashioned English, but in fact it's a false friend that's either come from another language, but is accepted in English, but it's not really used that often. So if I was to show you how I actually did that bit by bit, so I underlined all the words that have got prepositions in them. I'm not really sure about other languages, working a lot in French, but I know this is a particular problem in French because they have the preposition de that follows a lot of words, and they like to use nouns, so they have a lot of ofs all the way through their articles, which means that if they do this the whole way through, they end up having somewhere like 500 words that they can recuperate to use for dash or other things. So go through and underline the things that have got a preposition in it. Then put a circle around anything that looks like to be, so that's is or was, and that'll identify where your passive might be. Then I like to put a box, but you can choose your own favourite shape, around a noun, and so that would be a comparison. And then you start to recreate the sentence again. So the first thing is to start with the noun, the comparison. Okay, so that needs to become a verb. So it could become something like to compare, or it might be evaluation, to evaluate. Okay, then taking you back to primary school again, ask yourself who or what performs the action. So you have your verb, you've made it compare. Who compares? Well, the paper compares, or the authors compare. Sometimes, well, actually I would argue that the study compares because the authors don't actually compare themselves. Okay, then put the most important part, what I call the base clause, at the beginning of the sentence. So what is the most important part? Eliminate any unnecessary words or phrases, and then you get up something that looks like this. Okay, so if I was to give you now, remember I said earlier that I was going to give you an opportunity to practice. If you all have a piece of paper handy and a pen, I'm going to give you one to do yourself, to follow the same instructions again. Okay, so what you're going to do, and I should have done a slide, would have made it easier for you, but I'm going to tell you, what you can do is look for, firstly, any prepositions. So actually, I'll give you the example. Okay, so take a moment to look at this sentence and write it down if you need to. Identify where the prepositions or prepositional phrases are. Okay. Look for any to-be verbs or passive voice. Look for any nouns that could be made into a verb. And to identify a noun in English, particularly scientific English, it often ends in TION. And are there any long introductory, wind-up or non-specific phrases? So if I show you, this is not necessarily the most perfect example. I'm sure everybody's come up with something different. But this is one particular way that you could improve it. Okay, so how do we get there? So these are the prepositional phrases. This is our passive voice, the to-be verb. This is the noun. So the verb is, most important verb is to provide. What provides? Conference. To whom? Scientists. And with what? And I felt tertiary data was a little bit complicated. So in fact, I think I changed it. Well, so I changed it from tertiary data to appropriate information. So the final version would be something a little bit like this. The webinar will provide science writers with appropriate information and a way to share their research. So, just to summarise again, in fact what we actually did do, and if you wanted to take the time to quickly write yourself a checklist of the key steps, we looked for prepositional phrases, then we looked for to be. I like to put a box around nominalizations. Then I change it to a verb. I check that that verb is the main action of that phrase, because there will be other verbs in a sentence, particularly long, complicated sentences. Who does what? Then I put the base clause or the most important clause at the beginning of the sentence. And then I eliminate unnecessary words or I change words. Like for example, when I had the tertiary data, I changed it to information because tertiary data really is difficult to understand. So if I was to give you a chance to try now, another example. These are two ideas. This is a real example that came from a study. I'd like you to take a minute to see what option that you could come up with. Okay, so the answer that I came up with was raising awareness about this debilitating disease may improve patient care. This study investigates the perception, knowledge and opinions about Alzheimer's disease in France. Okay, by this I reduced a 2-paragraph or 2 long sentences into 2 shorter, more clear sentences. Here's another example that gives you an idea of how you can apply this to the methods section. Okay, often we get long, long complicated descriptions of how things are done. This is a particular example. And in fact, you can simplify that by just adding a list of commas. And in fact, what is really important is the fact that the capsules are ready to be used. So you can put that at the front and then say after you've done this, 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 and this. Okay, so now to give you another example, these are a couple of examples that come, well, this is one particular example that comes from a paper. Again, take a minute to have a look and see how you would edit this particular sentence. And in fact, excuse the is it this right at the end? That was that shouldn't be there. It's come from the comment section. Okay, so the answer that I came up with, it's not necessarily the best, but I found that it participates in is prepositional, so it was a bit long. And the word participate in seems a bit strange because participating is kind of we participate in a game, but for a molecule to participate in something didn't seem to be quite the right word to me. So I changed that to help. The noun preservation I then made into a verb, so that became it helps to preserve. Preserve what? And what is skin barrier integrity? So in English you can continue adding, you can make a noun group out of words together like this, and that gets rid of these two little prepositions and etc. here that we don't really need. In fact, we've got two here that we don't need. So that's 4 words we've got rid of. Plays a role. I felt a well was, again, sometimes it works in science, but here it was plays a role in the composition of ceramides. So it either is part of the ceramide or it's not part of the ceramide. This was a question that, in fact, which is why I have this here, a question that I actually asked to the author. Is it part of the ceramide or not? And so I actually corrected it saying that it was, and in which case it came to something like this, and is a component or a part of stratum corneum ceramides. That's actually looking at the time. I have other examples, but I'm happy to take some questions at this stage, and I'm happy to go through other examples if you would like, but if not, I'm happy to take questions at this stage. Okay?
Thanks, Amy. That was really good. Thank you. It was helpful. Because of the time, what I do think it would be fair to ask people to send any questions they may have by email to the pr@emwa.org address, and we'll get back to them afterwards, because I'm conscious that we're almost up on the hour and to be punctual. So if that's okay with you, I will take questions in that way, and we'll end it there. Okay?
Okay, that's fine by me.